Dr. Rose Zacharias is the president of the Ontario Medical Association, and she joins us live in the studio. Finally, Dr. Zacharias, we've had the pleasure of speaking with you virtually, so great to have you in person live. We've heard about the situation in hospitals right now, but big picture, how bad is the situation province-wide?
So this is the first time since the pandemic began that we are dealing with a regular flu season. So we know wintertime, people are more indoors, viral illnesses increase, and so we're dealing with influenza having arrived early, and we anticipate a severe flu season actually, as well as COVID-19 still circulating in our communities, and other childhood respiratory illnesses such as RSV, which is a common cold amongst kids, but some kids can get really sick with that. And so we're really calling it a triple threat. These three viruses, so important to get our vaccinations up to date, but that's the situation that we're dealing with right now.
And just to pick up on the kid situation, we're talking about how many more children are sort of, in emergency rooms and hospitals. That I think as CHEO has opened up a sort of second pediatric ICU to sort of deal with kids. I mean, you've got the situation with kids getting sicker earlier than sort of anticipated, so I guess in terms of the planning for that. And then you can't get cold medications, you can't get amoxicillin in some cases to treat the situation. It's just, it's really difficult to manage as a parent even when your child is that sick. So do you have any are there any quick fixes or quick solutions to help dial back this problem, or are we going to have to sort of fight through this?
I mean, I'm a parent myself, and we want our kids to be healthy. I've worked in the emergency department for 20 years. We see very worried parents showing up, sometimes waiting for hours and hours to be seen. The healthcare team inside that emergency department, they want to do their best and treat patients with kindness and respect and the therapeutic recommendations that they need. But we're in a system of overwhelm. We are short-strapped. We need more investments around the doctor shortage, the surgical backlog, which is contributing to people being sicker when they show up in the emergency department, and as well, people just don't have family doctors in the community. That's something else that we need to give Canadians.
And Dr. Zacharias, what we've learned from COVID and what we're seeing is that all of this is really kind of a case study in human psychology, right? People are calling for mask mandates. Experts like yourself and the Toronto Board of Health, the chief of staff at pediatric hospitals, because they know that given the option, people don't necessarily mask up. Let's face it, it's inconvenient. We don't want to. But do you think that the province is doing enough when they're saying, we'll see, up to you?
So we are monitoring the situation as well as our public health officials, and we need to be prepared to pivot for an official mask mandate if indeed that would be recommended in the weeks or months to come. And we know that masks can prevent illness spreading and prevent people from getting sicker and then coming into the emergency department and being in hospital requiring that care or an intensive care unit bed. And so wearing masks indoors in crowded places, especially when you're with vulnerable people, it's just handy to keep one in your back pocket, your kid's backpack, or in the glove compartment of your car to put on when you're going into places like that.
What's the general feeling amongst your associates, your colleagues in the medical profession right now about how they're handling the healthcare situation that we are in? Because it just seems remarkably stressful. I was in an ER 3 weeks ago with my son. You can see the stress on the doctors and nurses and all the different people there. It seems like it hasn't ended since COVID began. How do you sort of take the temperature? What's the feeling?
So I'm incredibly proud of our healthcare teams. I'm incredibly proud of my peers, physicians that are showing up under-resourced and on short-staffed teams all day and all night. These professionals are exhausted, and they went into the medical profession and nursing profession to do right by their patients, and yet our system has gaps that have been exposed by the pandemic. And so we are committed to working with all levels of government for increase of investments so that doctors and nurses can deliver the care that Ontarians need and deserve.
Seems pretty urgent, Randa, to get that investment indeed. Okay, Dr. Zacharias, appreciate your time this morning. Thanks for being here and actually being with us in person. Good to chat with you.
Thank you.